The broadcast is now starting. All attendees are in listen-only mode.
Good afternoon. Hi, everyone. This is Marissa Machado, COO for the Texas Association for Home Care and Hospice. I'd like to welcome everyone to Measuring Compliance Program Effectiveness, including the use of surveys and our sanction screening webinar today. So I want to thank Lyles Parker again, attorneys and counselors of law. We're very grateful for their continued support of TAC and the industry. Wanted to mention an upcoming training that we are having in May. That's May 1 regarding HCSA regulatory training. The content today is related to compliance, related to, I believe, more enforcement related to the OIG and your enrollment and ensuring that you're having a good, robust compliance program in place and utilizing it and keeping it alive every day. But I did want to mention that survey activity by our state licensure regulators have increased in fiscal year 2018 compared to 2017 by about 16.8%. So that's the highest in about 5 years. So we're seeing about 4,500 contacts to agencies, and we expect that trend to continue. That equates to about 84% of our agencies being surveyed each year. So just to go on to get started with the webinar, this qualifies for 1 hour. Oh, sorry, I forgot to mention the regulatory training. We have May 1st at the Omni Austin Hotel South Park, and you can see more of that information and all our events, upcoming events on our webpage under the education tab. Back to the webinar. This qualifies for 1 hour of CE for administrators and nurses. If you did not sign up for the webinar through our site, you may use the PDF form attached to this webinar to order your CEUs. The cost is $10 per person. Now it's my pleasure to introduce Heidi Kocher. Is a partner with law firm Lyles Parker. She has over 20 years experience advising and defending healthcare clients on legal and regulatory matters affecting providers of all sizes. She is an expert in all aspects of compliance and privacy programs, including developing and deploying policies, procedures, and training. Her experience includes serving as Chief Compliance Officer and Chief Privacy Officer, implementing the various requirements and aspects of corporate integrity agreements, and responding to and defending audits from Medicare, Medicaid, and private insurers up through the ALJ level. She received her JD from Georgetown University Law Center. She is licensed in Texas and in Maryland and admitted to the U.S. Court of Federal Claims. She is certified in healthcare compliance. So welcome, everyone. Heidi, take it away. Thank you so much.
Thank you very much for that introduction, Marissa. Also on the call with me today, I have Ishmael Lar, who is also one of the partners at Lyles Parker, and he's going to serve to keep me honest and straightforward and on a timely basis and chime in as needed as well. So
hey,
thank
Heidi,
you all for...
Hey Heidi, just want to say hello to everybody out there.
Thank you, Ish. So we have a lot of material to cover today. This necessarily is going to be at a relatively high level because there's a lot of material and just a limited time. Do want to say if you have any questions, please feel free to email us. My contact information is there on the first screen and it will be on the last screen as well. So where we want to go is a couple of things. And now, there we go. So this is going to be sort of the roadmap for today's session. We're going to sort of generally talk, and not in a lot of depth, about sort of where the compliance guidance and regulations come from. We're going to address specific elements that you need to be seeing in a compliance program and that the regulators and the OIG and the DOJ will expect to see in a compliance program, and then some suggestions for how to perform a compliance program effectiveness evaluation. And then if we have time, we'll do some Q&A. If we run out of time on the Q&A, please feel free to email me after the session. Okay, so let's plunge right in. So the bases for establishing a compliance program are pretty lengthy. They start from the U.S. sentencing guidelines, and Chapter 8 on sentencing of organizations actually was sort of one of the beginnings of the what we think of as a compliance program guidance nowadays. And the sentencing guidelines basically indicate that a compliance program has the potential to minimize punishment if there is an effective compliance program and if the entity that has been charged or is being investigated by the DOJ does voluntary self-reporting. But that really rests on a quite extensive history of compliance language. And I am not going to talk about these slides at length. You can read them at your own leisure later on. We will distribute the slides afterwards. But you can see that compliance actually starts back in 1863 with the False Claims Act. I'm sure you've all heard this before, but this was legislation that was enacted during the Civil War because what was happening was people were providing material to the Union Army and it was bad. So instead of providing biscuits for the soldiers, they were riddled with worms and moths, and the weapons weren't firing, and yet these individuals and companies were charging the Union Army lots of money. So that's where it all gets started, from 1863. There's a pretty big gap where there isn't a whole lot of legislative or regulatory movement, but then it picks up in 1965 with the Social Security amendments, and then it kind of goes on from there. And again, I'm not going to talk about these at length, but you can kind of see since the 70s, we see much more extensive interest in compliance and in compliance being effectiveness. So this slide as well just talks about some of the different elements of compliance that has been enacted. So we go from 87, from the Medicare and Medicaid Patient and Program Protection Act, which is the one that authorizes exclusion for the first time, to 2002 with the Sarbanes-Oxley Act, which is actually more financial fraud and compliance. And then we go into 2005, the Deficit Reduction Act, and into 2015 with the Yates Memo. We have here in 2010, you see the Patient Protection and Affordable Care Act, which also had quite a lot of expansion of compliance requirements. So that's just sort of legislative-wise. The OIG, which is a department or an agency, a sub-agency of HHS, has also spent quite a bit of time with compliance. If you look at this, again, you'll see that compliance guidances were first published in 1998, 1980, 98, 99, 2000, 2003, 2005, and up to 2008. So they spent basically, at least in the late 90s, and then for another 10 years, really working on compliance guidances. So one of the things I do want to point out here on this is that the compliance program guidance for home health agencies was issued in 1998. Folks, that's 20 years ago. The expectation is that you have looked at that compliance program guidance and really worked that into your plans. And if you really don't have a compliance program guidance, the question is not, oh, did you not have enough time to do this yet? But really, why did you not do this? Because this has been out for 20 years now. And you can see the compliance program guidance for hospices was also issued in 99. So one of the most recent things is in 2017, there was a document issued by, it's a joint document from both HHS OIG and the Healthcare Compliance Association, and they held a roundtable on measuring compliance effectiveness, and they put all of that sort of recommendations into a very nice document and issued that in March 2017. And it is a very good resource guide for anybody involved in healthcare to go through and look at that. And if you Google measuring compliance program effectiveness, you will, one of the first links that will come up will be the link to this resource guide. The DOJ, separately, the Department of Justice has also issued a lot of compliance-related guidance. One of the things that they actually did in 2015 was create the position of a compliance counsel. One of the problems had been that people were saying that the prosecutors really didn't understand how compliance worked. So they've actually now hired an individual who serves as compliance counsel at the DOJ. And this individual evaluates compliance programs for the DOJ in a prosecution and looks at not just the corporate wrongdoing, but also looks at individuals and what they may have done. 2015 was also the Yates Memorandum, and that was very important because what it did is it laid out criteria for ensuring that individuals in a fraud case are being held accountable. Up to that point, individuals were often sort of treated something as an afterthought. They tend to focus on the companies. In 2015, they said, going forward, we're going to start looking at individuals. And then in 2017, the DOJ, separately from the compliance guide, which was the OIG and HCCA, but the DOJ also published guidelines on the evaluation of corporate compliance effectiveness for the context of criminal prosecutions. And this kind of synthesizes all of the actions from 2015 and the Yates Memorandum, which tends to be more civil, and bringing them into a criminal context. So the guidance, the DOJ guidance focuses on these elements: analysis and remediation of underlying conduct, conduct of senior and middle management, the importance or stature of the compliance function, whether or not the compliance function is autonomous, is there funding and resources for the compliance program, and is that sufficient? What is the corporate response to expressed compliance concerns? What's this process for responding to any findings? What kinds of disciplinary action was imposed, and is that consistent? Is there a risk management process? Frequency of updates to policies and practices, and direct reporting of compliance to the board. So if anybody is familiar with compliance, the 7 elements of a compliance program, right? This is very similar to that, and you can see the influence of that on the DOJ guidance. But again, now this is something that the DOJ is explicitly looking at in a criminal context. There's other guidance out there. This is more specific to particular industries. Back in 1992, you actually had the AMA issue an ethical opinion on gifts to physicians from the industry. 2002, pharma issued its code on interactions with healthcare professionals. And in 2004, AdvaMed also issued its code of ethics. And again, the pharma code and the AMA ethical opinion and the AdvaMed codes, they're all voluntary guidance. But again, they sort of serve to establish what the industry standards are for what they think should be the appropriate interactions within the healthcare industry. So something to be aware of. Again, if you work with pharma a lot, you might want to look at the 2002 pharma code. And that was, of course, revised in 2009, just as the AdvaMed code was as well. So again, if you're dealing with pharmaceutical people, device people, you might want to look at those as well. And in case you were wondering, there is something that is specific for home health agencies. So as you all know, there were new COPs that were issued in 2017 and effective January 1st of last year. And those include compliance elements now. One of the specific things is that the HHA and its staff must operate and furnish services in compliance with applicable federal, state, and local laws and regulations. And in evaluating compliance with this COP, they again are looking at sort of what we've talked about already in terms of compliance, how you create a compliance program and what it should look like. So everybody has kind of come to the conclusion that an effective corporate compliance program actually has a lot of benefits. So let's kind of talk about what these are. First of all, they're going to provide clear direction and guidance to your employees about what the expected conduct is, and it's going to encourage reporting of any issues, any deviations from that expected conduct. A good corporate compliance program is going to help you identify not just fraud, but also things that aren't fraud but are problematic otherwise. It's going to establish guidelines for how to investigate and promptly resolve any identified problems. It will hopefully and should improve the quality, consistency, and appropriateness of the services that are being provided and the documentation of those services, which of course is very important because the documentation is going to be what underlies medical necessity and ultimately payment. An effective corporate compliance program is going to demonstrate to the government and the community your commitment to responsible and honest behavior. And finally, in summary, the anticipation is that all of this will ultimately prove financially beneficial because as you are doing things compliantly, your claims will be compliant. You won't have to deal with overpayments. You won't get recoupments. You won't get, God forbid, trouble damages because of something that has happened in the past. So in the long run, an effective compliance program will save you money. All right, let's talk now about elements to consider in evaluating your compliance program. Changing gears a little bit here. The key to a compliance program is its effectiveness. And again, I put this in red, italics, and underlined because this is so true. It doesn't matter what your compliance program looks like on paper if it doesn't work in real life. And to drive that home, the original compliance program guidance for hospitals used the word effective 19 times, but in the recently published resource guide, the word effective or effectiveness is found 41 times. So really a big emphasis on what is it doing, what does it look like in real life, how does it work in your organization. I'm going to turn to, again, the Compliance Program Effectiveness Guide that was put out by the HCCA and OIG Roundtable, because I think this is a really good resource for everybody, and I would encourage everybody to download this and read this. So the Roundtable met and they spent a day, just a day, an entire day, talking about compliance programs. So that was January of 2017, and they collated everything and issued the guide in March of 2017. And the purpose of the guide was to, as they put it, provide a large number of ideas for measuring compliance and the effectiveness of a compliance program in all kinds of organizations, different sizes, different sub-niches within healthcare, different operational complexity. It's intended to work from the smallest pharmacy or home health agency to a large academic medical center. So what this does is it has a bunch of, a whole listing, it's pages and pages of what to measure and how to measure compliance. Again, sort of using the rubric of the 7 elements of a compliance program. I do want to say that they have discouraged using this as a quote-unquote standard or certification. Again, one size does not fit all, so you cannot say, oh yes, we measured our program in relation to this guide and we met all the standards. Some of the elements, some of the questions will not apply to your organization. Some are going to be very important for your organization. It is a tool. It is not a standard against which you will be measured. But it does come up with specific elements to consider in evaluating your compliance program. So again, you can see what pretty much tracks with the 7 elements of a compliance program. You should be looking at hotline calls. And again, you may not necessarily have a hotline, but any reports of problems. You should be looking at education. This includes staff education, marketing, intake, billing, patient care, physicians. You're going to look at any focus arrangements, which are arrangements where the physician has a relationship with the agency in particular, such as an ownership interest or a compensation interest. So any physicians, for example, who have medical directorships with your agency are somebody that you want to look in depth, and you want to understand what you need to do about a focus arrangement and how to make sure those are compliant. You want to be educating your board of directors or managers, and you want to be educating executives. You need to be looking at policies and procedures. You need to be looking at audits and monitoring the results of any trending. Potential areas of trending that you should be looking at is your coding and billing. You should be monitoring sort of how many denials you get for codes. You should be monitoring what your top 5 or your top 10 codes are per claim. In terms of services, you should be monitoring your top diagnoses codes. And if you see changes over time, that's something to dig into more. You want to be benchmarking these audits. So again, you do an initial audit and you say this is where we're starting from, and then over time you keep comparing to the benchmark to see if you're hopefully improving, hopefully not improving or getting worse, and perhaps just staying the same. You can also benchmark against others in your state, in your industry, for a scorecard. You should also be doing an audit work plan every year, and again, doesn't need to be anything all that extensive, but you should probably be evaluating 20 claims per quarter and taking them and auditing them, making sure that you have all the appropriate documentation, that the billing is correct, any repayments are paid. If you have to collect co-pays and deductibles, those are being collected as well. You want to be looking at budget analytics. You cannot do compliance without some resources, specifically some personnel, and you need some money for some things. So you want to see how much money is devoted to compliance. And there may be other data points to trend from year to year. One of the recurring themes that we see in measuring compliance is a claims processing or audit function. And again, you want to benchmark what you're doing, your claims program, with similar ones in your organization, and you want to benchmark the data across your organization over time. This is all about knowing where you stand and where you're going. Another big theme in measuring compliance is how you investigate and report or respond to potential violations. You want to look at the process for doing that. You want to look at whether or not you're sampling any claims. And of course, at the end, you want to be looking at if you are promptly refunding any overpayments, again, adhering to that 60-day overpayment rule. And then the third theme in measuring compliance is education. I once had somebody tell me that if you don't know where you're going to end up someplace else. And this is very much an underlying theme with education. You need to be telling people what they should be doing so that they do that, because if you don't tell them what they should be doing, they're going to end up doing something else, what they think they should be doing. So you want to be very explicit about your education. So many of you have talked about the 7 elements of compliance. This is shifting a little bit. The sort of pillars are being reworked a little bit, and sometimes they're being collapsed a little bit. I've actually seen 6 elements of compliance. But what I did on the left-hand side was sort of where the OIG has their 7 elements. Remember, these came from the compliance guidances that were published back in the 90s and the early 2000s. HCCA has its 7 elements down in the lower left. And now on the right-hand side, we are seeing some other people in the field coming up with slightly different rewording of these things. And I'm going to talk about that in just a little bit. But I want you to know that essentially they all boil down to the same thing, regardless of whether it's the OIG 7 elements or the example down here, example number 4 in the lower right, from another organization. They all are pretty much looking at the same thing. So let's talk about the, again, sort of new, quote unquote, 7 elements found in the HCCA Compliance Effectiveness Guide. And again, we're gonna kind of see how these compare. So you've got standards and procedures, number 1, compliance program administration, 2, screening and evaluation of employees, physicians, and vendors, number 3, communication and training, 4, monitoring, auditing, and internal reporting, 5, discipline for non-compliance, and investigations and corrective action plans and remedial measures. So let's line these up with the original 7 elements. So the original 7 elements are on the left, and the new 7 elements are on the right. So you can see that number 1 is essentially the same. Number 2 moved from designating a compliance officer and compliance committee to a more generic and higher level compliance program administration. This is really more comprehensive than just appointing a compliance officer and compliance committee. They really want to know how you're doing compliance as a whole. Number 3, effective training and education was moved down to number 4, and they added a new screening and evaluation of employees. So that's completely new as an element. And 3 and 4 were kind of collapsed and reworked. So it becomes communication, education, and training rather than just training and education. Hotlines were moved to number 5, monitoring, auditing, and internal reporting. And again, because what often happens is a hotline then becomes part of your audit process, right? And number 6 and number 7 remain essentially the same. So you can kind of see how the guidance is evolving to make sure that compliance programs are effective. And I would expect this kind of evolution in the standards to continue over time. All right, moving right along very briskly now. Element number 1, standards, policies, and procedures. This is the written stuff. You want to make sure that you have appropriate policies and procedures in place for marketing, your physician relationships, patient intake, documentation of medical necessities, services provided, etc. Lots of resources out there to help you understand what you need to do in terms of patient intake and documentation. Coding, record retention, and handling of overpayments is another bucket of policies that you really should have. Again, overpayments, make sure you are addressing the 60-day overpayment rule. Conducting internal and external compliance audits. Again, you want to be doing periodic audits internally, and if you can afford it, have somebody come in periodically externally to do an independent audit. You want to make sure you have policies addressing regulatory requirements, not so much EMTALA for you, but Stark, anti-kickback statute, and so on for anybody else. Conflicts of interest, confidentiality, privacy, gifts and gratuities, and you want to be conducting periodic reviews of policies and procedures. It is really pointless if you have a policy and procedure from 5 years ago. How do you know that people are still following it? So really what you want to do is your policies and procedures should be part of a compliance and operations manual, and you integrate the policies and procedures along with a mission statement about the values of the companies and a code of conduct that has your ethical principles in it. Policies should be reviewed and updated whenever you have an issue or an incident, and at least annually. This is very important because if you have an issue, it may indicate that your employees don't know what to do, and your policy is therefore too vague or too broad. Policies also work as the basis for an audit. They establish the standards that you audit against. So questions that I always ask is, are the policies easily accessible to your employees? Where are they? How can people access them? Do they even read them? And here's another thing. Are they used? A major red flag is pristine pages in a binder that is covered in dust. That is always an indicator to me that there are bigger problems in an organization. Now, if your policies are online, that's a little bit harder to assess, but you want to make sure people are really looking at these policies. And again, anybody who's in charge should be updating these at least on an annual basis. So element 2, compliance, program administration, and a related budget. So again, a successful compliance program needs a compliance officer. This is somebody who is responsible and the touchstone for compliance in your organization. Now, smaller organizations may have somebody doing dual duty, but that person, if they're doing dual duty, really needs to be able to carve out time in his or her day to run the compliance program. You need to have adequate staff beyond just the compliance officer and adequate budget in order to deal with compliance program activities. I will say that an insufficiently staffed or insufficiently funded compliance effort is almost worse than no program at all, because if you have a compliance program and you don't dedicate sufficient resources to it, then the government's approach is you knew what you were supposed to do, but you deliberately chose not to do so, which is really evidence of bad intent on your part. So again, really make sure you dedicate sufficient resources to a compliance program. One of the things that you're going to be looking at with the compliance officer and the other compliance staff is determining if the compliance program is part of your organization or apart from it. So where is your compliance officer located? Is he or she in a broom closet, in an annex? Do people even know who the compliance officer is? So these are key questions that you want to be looking at in terms of education for your people about the program itself. You want to have an annual work plan, and that should include a process to evaluate the effectiveness of the compliance programs and any risks. So again, ultimately what you're going to be asking is your compliance program independent, and is it objective? Is there independent reporting for the compliance program to those in authority? You know, going to a board of directors, relevant committee, or in a small organization, the boss or bosses. You really want to make sure that compliance is not shunted off to the side, and you can say, oh yes, we have a compliance program, but nobody in your organization can mention anything about that. Part of this is, of course, creating a culture of compliance to make sure that compliance is part of your organization's fiber. So you want to try to measure employees and attitudes. Do they believe it's real or sham? And this is very easy to do with employee surveys or management assessments. And it doesn't need to be anything fancy. You can ask 5 or 6 questions and get a really good read to determine if your employees know about compliance. So again, you want to not just have your managers talking about compliance program, but you want to have even your low-level staffers being able to talk about a commitment to compliance. You want to make sure they understand how the compliance program operates and what their obligations are. Part of creating a culture of compliance is making sure that your board of directors or any oversight committee is engaged. Again, they need to understand what the regulatory authorities are, what the requirements are, and what employees should be doing. They are sort of the ultimate and independent authorities for particularly companies of medium and large size. And if you have a board of directors that has a compliance committee, or with the board as a whole gets periodic compliance reports, that helps demonstrate to commitment and what is known as the tone at the top. Element number 3 is the new one, the screening and evaluations. So what you need to do is, again, you need to monitor your sanctions list. Again, I presume that everybody is doing this. I'm not going to go a whole lot into this. Just remember that you may need to screen third parties, consultants, vendors, and so on. And excluded persons are deemed unacceptable risks for patient safety or financial integrity to government programs, which is why you need to very carefully screen them. Again, I'm not going to talk about this a whole lot. Oops, slide bumped up. Except to say that remember that anybody who is excluded is considered radioactive, and I call exclusion the healthcare death penalty, because you probably won't be working in healthcare again if you're excluded. One thing that I do want to point out is that the exclusion prohibition applies to people that you might not think about. This is going to include IT services, strategic planning, billing if you outsource it, human resources. People on the exclusion lists include lawyers and accountants and marketers. And note that even an excluded volunteer, if you use volunteers, will taint a claim if his or her activities contribute to the services that underlie that claim. If you've got an excluded volunteer, you have to make sure that their activities are wholly unrelated to the receipt of federal healthcare dollars. And actually that applies for anybody. If you're looking to hire somebody who has been excluded, you have to make sure that they are really segregated and that their activities are completely unrelated to any federal healthcare program. I will say it makes it very difficult to employ or contract with somebody who's excluded. Here's the liability for failing to appropriately screen. You've got overpayments. My slide keeps on jumping. Overpayments, potential CMPs, and actually this just jumped up to $20,000. So if you have an exclusion violation, the CMP is now up to $20,000. You've got false claims exposure. The DOJ has in fact filed a number of false claims act cases since 2015 that are based on an excluded person's participation in Medicare or Medicaid. Here's the other thing. Private payers are now also seeking reimbursement if you have an excluded individual. One of the things that I would suggest to you is for everybody on this call to pull out your private payer contracts and go through them. I'm not talking about looking at the fee schedules or whatever at the back, but if you have any private pay contracts, they virtually all now have compliance requirements in them that mimic the federal requirements. So you really need to make sure that you're not violating any private payer contracts because you don't want to be breaching your contract there. And just be aware that, again, if you have an excluded individual, I hate to use the term problem, but they're a problem in more ways than one. It is the problem employees who also have drug addiction issues and quality of care issues. It is the problem employees who bring licensure concerns for your agency. So another real concern to emphasize why you need to be screening individuals. This slide just again basically talks about that, talks about the various kinds of risks that your employees, your humans impose or present for you in terms of legal and regulatory, clinical and patient safety, and sort of general human capital issues. So again, just something to think about, and it really drives home the fact that you should be, if you're not already, and I'm sure everybody is, but you really need to be screening all of your employees and vendors and so on. Real briefly, why this is important. Again, a whole bunch of exclusions are licensed service providers. 58% are nurses or nurses aides. This is, of course, very important for anybody providing hospice services. I will note that it's about half and half split between mandatory exclusions and permissive. The mandatory exclusions are really patient abuse or neglect, and you'd be surprised how many exclusions there are for that. Program fraud or a drug conviction. The other half, the permissive exclusions, are generally related to a loss of a professional license. And a loss of a professional license is often underlied by things like patient abuse or neglect or a drug program. So again, all kinds of concerns that you have why you need to be screening people and making sure they are not providing services to patients covered by your home health agency or your hospice. Again, just some of the requirements. HHS and OIG has them. You've got the LEIE. By the way, if you take only Medicaid, you should know that the state Medicaid unions require providers to screen monthly. I have a number of people that have told me, oh, well, we only screen these on an annual basis. That's not good enough. Again, the states are requiring people to screen on a monthly basis, so you may as well be screening everybody on a monthly basis. And again, there are separate requirements. Again, Texas requires providers to certify upon enrollment and re-enrollment that they don't have any employees, vendors, or contractors that have been excluded from any state or federal program. So again, this really drives home the importance of screening the state databases as well as the federal ones. Element 4, training on compliance issues, communication and education in general. So the point of training is to take this very dense and sometimes complex laws and regulations, convert it into hopefully a format that your employees can understand, and then make sure that that information is spread throughout your organization. This is part of what promotes a culture of compliance throughout your organization. And again, the training and education will help the board of directors not only understand the organization's obligations, but again, how the employees are informed about these. So this is part of a board's obligations to understand what the organization is doing. Again, it assures that your workforce are educated on compliance policies. Again, so you take sort of the regulatory material, and then your policy will say how it works in your organization. Be aware that many licensed professionals also require compliance training to maintain their professional competence. And these policies and procedures really are intended to encourage employees to seek guidance and clarification when there is any doubt. If you do not have employees coming to you saying, hey, I had this new issue come up and our policy, doesn't quite address it. If your employee says, hey, I've had this new issue come up and our policy doesn't address it, I think I'll just do this, and not checking is really a problem for you, because that's really how problems, claims issues, other regulatory issues really start and move forward in your organization. And you want to have general compliance training, again, for all employees, not just those who are involved in coding and billing and patient care. You want to have it for marketing. You want to have compliance training available for your vendors, and particularly if you have physicians serving, again, for example, as medical directors, you want to have your physicians trained on these issues. I would recommend that you also make training available to physicians on any of the other documentation issues that you face. For example, face-to-face. It's a huge issue in the home health space, documentation of face-to-face. Make training available for your physicians to help them understand what their obligations are, because the more you can get them trained and the more they do the face-to-face right the first time, the less work you have to do on the back end to chase down signatures, to chase down correct verbiage, to chase down the documentation itself. So as you're doing this training, you want to make sure that anybody's participation in the training programs is tracked, and you also want to evaluate understanding of this training and their compliance responsibilities. And you can do this by means of quizzes. That's the most common thing I've said. This training can be provided on a computer basis or in person, whatever is better for your organization. Training. Again, one of the things that I evaluate is whether or not training has been conducted at least annually. You want to have sort of your general compliance training done annually, and you want to document it. Again, part of this is the repetition and the enforcement, that adherence to the laws and regulations are important and a condition of employment. You need to remind them annually that failure to comply with the laws, regulations, and your agency's policies can result in disciplinary action, including the possibility of termination. Now, note that you may need training in between your annual training if there are changes to policies or procedures, or you've identified an issue. Let's say, for example, you've had a coding issue where it wasn't clear, and you now have a new policy on how to code a particular claim. That is something that can be done during interim training sessions. I would love to see staff meetings be used as compliance training sessions, and not just compliance, but sort of more general compliance, small c. Training sessions where you go over, new changes to regulatory requirements, new changes for how you're documenting things in the OASIS, a new procedure that you file for LUPAs. Whatever it is, you want to have this consistent training and you want to be documenting it. All employees should be provided an orientation and training within the first 30 days of their employment. I mean, I know many people sort of roll their eyes and it's like, oh, day one, here I go with all the training. As long as they get it done in the first 30 days, that's what counts, and you want to make sure that they understand what their obligations are as a member of your team. You need to always document employee participation. Now, for the annual training, you can, if you have a computer-based system, that's very easy to do. If you've got sign-in sheets, that's wonderful, but make sure you don't just grab the annual training. Again, make sure you document the periodic training that you're doing during the year. Again, if you use staff meetings as a training opportunity, make sure you document that. I've put up here a sample language for a compliance training attestation. You can put this in your onboarding paperwork, particularly after they've completed their compliance training. And again, if an employee has signed this, they are now on notice about the importance of compliance and the requirement to comply with this, including the fact that they may be terminated if they violate policies and procedures. All right, element number 5, monitoring, auditing, internal reporting systems. So again, as you saw on the prior slide, this combines just the hotlines and internal auditing and monitoring. Excuse me. So the purpose of element 5 is to, number 1, identify risks. You should be looking for what potential and existing risks are for your organization. You need to have a systematic identification of what those risks are. They're going to include things like documentation. They're going to include things like coding. They're going to be billing risks. You may have risks relating to administration of medications. You may have risks, for example, relating to therapy. Whatever those risks are, you want to systematically sit down and think about what the risks are in your organization. And those risks are going to be two. There's going to be sort of your generic general healthcare risk, those that you would expect to see in any healthcare company. Again, coding, billing, types of things. And then there may be specific risks that are unique to your provider. So for example, if you are doing telehealth, you may have specific risks in your organization due to the telehealth program. If you've got physician ownership, not that I'm recommending that, but if you have ownership issues, you may have very specific risks. If you have, somebody who is related to a physician owning your home health agency or your hospice, you've got some very specific risks due to that ownership interest, and you need to make sure that you have addressed those very specific risks as well. Excuse me. So hotlines and internal reporting, things that I would be looking at if I were doing a compliance effectiveness program. I'm going to be looking at your internal reporting systems. How do employees come and tell or let somebody know that there's a problem? I recently did a compliance program evaluation, and they told me that they have never had any hotline calls. And I said, okay, so how do you know about compliance issues? And the compliance officer said, well, it's not uncommon for me to be down in the employee cafeteria, and people walk up to me and they say, hey, I have this question, or I have this thought. And so when we looked at their issues log about what the issues are, probably about 75% of those were identified by employees walking up and simply talking to the compliance officer. And the other 25% were identified either because senior management had a concern, or there was a piece that came out, a regulatory change that came out, an article came out, and that became a compliance concern. But I think it's really wonderful if you can say, hey, my employees felt comfortable enough to approach the compliance officer with any concerns. Number one, this really gets to culture and how compliance is a part of your organization, that individuals, A, know who your compliance officer is, and B, feel comfortable enough to talk with that individual. So you want to look at internal reporting systems. You should also have anonymous reporting. You can do either a telephone hotline or an email address. And again, that is available to anybody. I think you should always have a hotline. They're not often used, which is okay, as long as you have that there and available, because sometimes people do want to make anonymous reports. And particularly with any of this reporting, you want to make sure that you have a no retaliation policy. This is something I look for as well. If reports are made in good faith, they need to be treated with respect, and the individual should not be retaliated against simply for making a report. And again, I would just note that the OIG has been urging the adoption of hotlines since 1998. So again, 20 years that they've been saying this. We're going to run out of time, so I'm going to skip a little bit on sort of why internal hotlines or reporting systems like hotlines are wonderful. You can read that at your own leisure. Monitoring, auditing, annual work plan. Again, what you want to do is you want to identify your risk areas and perform a baseline audit. It's a good idea to get employee input on what your risks are. And then once you have identified risks, you need to prioritize them and determine how to address them, what you're going to do in the way of auditing to determine if there is in fact a risk and to help identify potential corrective actions. If you are doing monitoring and auditing, you may need to consider attorney-client privilege because if an audit shows up bad things, what does this mean? So before you plunge ahead with particularly a very extensive audit, you really want to think through whether or not you want to privilege this. And again, make sure you have an annual plan that covers some basic areas. You can complement your planned basic reviews with other focused or for-cause audits and reviews based on particular issues or circumstances. Always start with coding and billing, including the documentation supporting your coding and billing. I've put up here some samples of a documentation checklist. They come from CGS. I know CGS is not the MAC for Texas, but hey, we take our resources where we can find them, right? So, and then take a look at these, build your checklist off of these, and then look at any specific issues for your particular agency or hospice. Do you have issues with home band? Do you have issues with therapy visits? Do you have a nursing home hospice relationship? A big question currently is medical necessity for hospice. Is the patient terminal, and how long do they remain on hospice? So all of these things are very important to look at. And again, benchmarking is very important. You want to look at how your practice is compared to past, and also compare yourself, if you can, with other practices who are of a similar size in your state and nationally. The important thing to do here is establish consistent reviews. You want to do it every year, and you want to do it every year the same way. You can do statistically valid random samples. You don't necessarily need to go to that extent, but you want to make sure that you, again, any samples that you pull are in fact random and consistent so that you can compare your measurements over time. Discipline for non-compliance. Again, very important to have these policies out there. This is something I look for. You want to make sure that you have a zero tolerance policy for fraud and abuse, and that employees have a responsible to identify any particular issues. Your policy should state that they have to exercise good faith efforts to comply. You can put in there that they must treat each other, and particularly patients and visitors, with dignity and respect. Don't forget that you have discrimination laws that may come into play here as well. Your policy should, again, talk about providing a high level of service regardless of the payer. You don't want to divulge any proprietary or confidential information. This is your HIPAA privacy issue here. And you should also note that compliance is going to be a factor in performance evaluations and compensation decisions. And as a matter of fact, I was working with a client just this morning on looking at performance evaluations and how we incorporate compliance as a factor into the annual evaluation. You should be verifying that any compliance-related violations are addressed in a timely manner, and disciplinary action is recommended and then imposed when non-compliance is in fact substantiated. You want to make sure your discipline is proportionate to the violation and, again, consistent with your policies and procedures. One of the things that we sometimes see, and I want to caution people about that, is lower level individuals get harsh discipline. They're fired, for example, when senior management doesn't seem to be subject to the same level of discipline. This is problematic from a regulatory standpoint, but it's also problematic from an employee morale standpoint. They want to make sure that everybody's being held to the same standard. You want to, again, make sure you've got action if there's any exclusion, and if anybody needs to be reported to the licensure or regulatory bodies, that you do that as well. You may need to consider quote-unquote discipline for non-employees as well, for example. So for example, if you have a contracted vendor or a contracted physician, you want to have a means of disciplining them. You may require additional auditing or training or additional approvals for a process, reductions in amounts paid, and ultimately, if this discipline fails, you should have a provision permitting you to terminate the contract or relationship. Investigations and remedial measures. These are a bunch of questions you need to think about when you initiate an investigation. Again, what type of investigation am I conducting? Is it best to conduct an internal investigation? Should I hire an attorney and an outside attorney to do this? Do I have an in-house counsel perhaps that can do this? So again, you want to consider, are there any attorney-client privilege experts? Any attorney-client privilege issues. Do you need a subject matter expert? Again, is this a very extensive audit? Do I need to go to somebody outside? What is the scope? of this going to be, again, am I looking at a fairly time limited thing, or is this, something that has occurred over a long length of time? You want to consider if disclosure is likely to be necessary. If disclosure is important, this may impact how you conduct your investigation, and again, it may influence your decision on whether or not you need to bring in an attorney. And do you need to think about preservation of evidence, maintenance of records, and other government cooperation issues? So before you just start investigating, you kind of need to think through those, particularly if you have an indicator that this is going to be a serious issue. We've kind of talked about this. The last thing that I would mention here is don't forget to document any corrective actions that have been taken in response to an investigation. Very important. This is just a slide to sort of, again, help you think about all the potential federal and state agencies that may be involved in an investigation and to whom you may report the results of your investigation. So you can kind of read through this at your own leisure. Again, when you conduct an evaluation of a compliance program, every agency is different, every company is different, every circumstance is different, every compliance program is different. It's just like human beings. We're all human beings. We all have, a skeleton, we all have skin, we all have eye color, but we are all different in many respects. So in that regard, you want to think about who is going to conduct the evaluation of your compliance program. You want to have somebody who understands the risk areas specific to your size, your company, and your service. You want to try to establish a budget so that you have choices. And you want to ensure independence to the vast extent possible. And whoever is chosen to conduct the evaluation needs to be reporting independently to management or the board of directors. You really want to make sure that you have somebody who has expertise and experience in order to bring credibility to the results. You want to utilize the findings for improvement and then re-audit again to see if those have stuck. And a key thing that I have here is if your auditor makes suggestions for improvement, follow those. They know what they're doing, and particularly if you have an independent auditor and they have made recommendations, the fact that you don't do those may lead to an indication or a suspicion that you're really not following compliance guidance and regulations as thoroughly as you should. Again, a couple of things to consider. This kind of harkens back to our first issues. And my final thoughts on this are just do it. Do something, do anything to evaluate your compliance program and document it. Perfection is the enemy of getting it done. That's my presentation. I have probably time for one or two questions before we need to wrap up. Thank you. I hope everybody also enjoyed it. Again, a lot of information. I know I moved at a very rapid clip. Would love if anybody has any questions, they can email us directly.